Good afternoon. I am Dr. Hrishikesh Salgaonkar. I am a consultant bariatric surgeon working at Fortis Hospital, Mulund in Mumbai. I am a bariatric surgeon and I work with a lot of patients who struggle with obesity and they come to me to seek help. Now, one of the common question that most patients have is, why do we gain weight even when we are eating less? Uh, so the real metabolism story behind this is, there are a lot of factors that go on when you go on a dietary plan or when you are trying to lose weight. And when you are dieting or when you are eating less, yeah, it can be very, very confusing and, it can be very, very frustrating. At times it seems unfair that, I'm trying to do my best when it comes to my diet, but still I'm not losing weight. In fact, sometimes I end up gaining weight. Now, there are a lot of biological reasons for this. And the first thing is when you are dieting, when you go on a calorie restriction, as a natural protective mechanism, your body has a tendency to go in what we call as an energy saving mode. Uh, Now, what that means is when you're eating less, your calories are less, your body's basal metabolic rate will come down. And when the basal metabolic rate comes down, typically, when you are resting, you'll end up burning less calories. Body has a tendency to try and conserve calories and store calories. So at times, the fat storage in the body will go up. Uh, and this is what we call as metabolic adaptation. So basically your body is trying to protect you, it is trying to conserve energy. Similarly, there are a lot of hormonal factors that can lead to this. So when you are starving or when you go on a dietary plan, your leptin levels in the body start going down. Now leptin is a satiety hormone, that is it will make you stop eating. But when you're dieting, the leptin levels go up. Similarly, the counter regulatory hormone, which is ghrelin, which is an appetite stimulating hormone, can sometimes go up, as a result of which you'll end up becoming more hungry. And similarly, as a stress response, the cortisol levels in your body will also go up. Now, cortisol is a stress hormone. It slows down your metabolism. It will increase your tendency to store fat and also to gain weight. Again, when you are dieting, if you are not careful, if the protein intake in your diet is not good, or at times if you are not exercising, not doing muscle toning exercises, typically you are also losing muscle mass. Now, it is important to realize that when you are losing muscle mass, your metabolism will slow down because your muscles are the real fat burners. And when your metabolism slows down, again, it is very easy to gain weight and it is very easy to store fats in the body. Now, these are some of the common things that go up. It is also important that you make some real lifestyle changes, because when you are dieting, it's a stress on your body. And if you are sleep deprived or if you are not having adequate sleep, that itself will increase the stress in your body. Your cortisol hormones will go up. Again, that will make you hungry. Again, it's very easy to gain weight in such a scenario. And also your fat storing capacity in your body will go up. Again, lot of obese patients, throughout their journey, when they are trying to lose weight, they follow multiple diets. Many would have heard about, say, intermittent fasting. Some patients will just go on a calorie restriction. Some patients will follow what we call as meal replacement, so they'll replace an entire meal. Sometimes they skip their breakfast, or sometimes they'll just have one meal in a day. So they follow multiple diets, and some your body will get confused with this. Your body also remembers the various dietary patterns that you do, and a protective mechanism is stimulated. It feels that you are going in a starvation phase, and as a protective mechanism, again, it tries to conserve all the energy that is there, so it will again reduce your basal metabolic rate, so you are burning less calories in such a scenario. And typically, patients go in what we call as a yo-yo phenomenon or yo-yo pattern, that is seen very commonly in patients who do lot of dieting and lifestyle changes. So typically with dietary patterns, they will lose, say, about few kilograms in weight, but at some point of time, the control goes up, and when they gain weight, they don't go there to their normal weight. They would end up going even further higher. And this is what we see over a period of 10 to 15 years, and progressively, patients will keep on getting more and more heavier as time progresses, and it is more and more difficult to try and lose weight. At the same time, there can be multiple medical causes, which can lead to weight gain, despite best efforts at dieting. Now, The common conditions are conditions such as hypothyroidism or Cushing syndrome, patients who have PCOS or polycystic ovarian syndrome, hyperinsulinemia, where your insulin levels in the body go up. Patients sometimes will have chronic inflammation in their body. So all these patterns, cause what at times water retention in your body, and they also will make certain hormonal changes, as a result of which you'll either not lose weight or you'll end up gaining weight. So whenever you're dieting, whenever you're following any weight loss program or weight loss lifestyle changes, it is very important that your body is trying to protect you. It is not trying to punish you. So whenever you go on any dietary pattern, any dietary program, as a protective mechanism, your body is trying to reduce your basal metabolic rate. It's trying to conserve energy. It is very, very important that we stay disciplined, we stay persistent, and if despite your best effort, if you are struggling to lose weight, then don't hesitate to take help from a specialist, and we will try our best to see how best we can help you on this. Now, obesity is a complex relapsing disease, so we have to be persistent and disciplined in our fight to manage this disorder. Thank you so much.